Hi, today we're going to talk about the Ray Pediatric Full Face Mask. This is going to be a vented full face mask. Before we dive in, we are going to talk about the size guide. So every one of these packages will have a size guide for you. The size guide for this will be highlighted in red. Your size guide will have small through extra large. And it is packed individually. So this is not a kit like our nasal mask. This will be, each package will have a separate mask for small, medium, large, and extra large. This size guide is going to be reusable, so you can wipe it down with your institutional wipes. So make sure you do size your patient correctly. There is a diagram right here to show you how to size correctly your patient as far as where the size guide should be fitting. Obviously my mannequin is not the right size, but you can see where you should be fitting your patient. In the package, you will see that your full face mask is going to come with extenders, the headgear, the frame, the cushion, the trunk. Your trunk is going to be a 360 swivel as well as a 360 swivel here as well. Your trunk is actually going to be removable if needed. If the dead space is going to be too much, you are able to attach an Omniflex if needed. Again, remember this full face mask is vented and you do have your AAV here as well too. This is going to be interchangeable as well, so if you feel like your mask needs to be swapped out or changed, remember you can take this out. The frame is going to be here and you are able to switch out your mask. I will say there is a little tip on this as well too. I know you guys cannot see this, but there is a little notch here where you will have to seat your mask properly. So if it is not seated in properly, you will have a leak. Please make sure it is seated properly on that little notch, because that is where you will find your leak. Instead of here, it would be closer to the nose and you'll feel it. So please make sure that that is sealed and seated properly. Okay, and when you are placing this mask, it is recommended that you make sure that the Sunset logo is facing outward and not inward. The Sunset logo is not supposed to touch the nape of the neck. It is supposed to be facing outward the nape of the neck. So as an example, I would put this on the patient first. This is just an example, and then make sure that you are making sure that the Sunset logo is facing outwardly. What you want to make sure is that when you're looking at your patient, everything is nice and midline, okay? You want to make sure that you are going to tighten the T-strap first, then the nape of the neck, okay? Unfortunately, my example, he's an adult head. I don't have a pediatric, but you are going to strap in these, tighten the bottom straps, and then you are going to tighten this strap. And remember, when we say tighten the straps, we don't want it to be as tight as possible. We want it to just be tight enough to where we aren't putting so much pressure on the forehead. We do have a technology on our mask. It's called FinTech technology. And what that is, if you guys are wondering what is this on our mask, it is actually going to help you bring the mask to the patient, okay? You are going to press this fin technology, okay, together like you're pinching. Pinch it, and then bring either the mask away from the patient or to the patient, right? So you can see here, I am pinching this plastic piece, pinch, and then I am bringing the mask to the patient. Okay, you can bring the frame to the patient to make it tighter, if you will, or alleviate the pressure from the bridge of the nose. Okay, so I'm going to take it and push it away from that patient. So I will do it again. Pinch this and push it towards the patient if there is somewhat of a leak, okay? And then pinch it again and take it away if there's too much pressure, okay? And there are different levels to this. There are about 4 to 5 notches that you can mess with to either alleviate the pressure on the bridge of the nose or create a little bit better of a seal so that you are leaking into the eyes. And do not forget, whatever your institutional policy is, to make sure that you do have a skin barrier at the very least at the bridge of the nose. Okay, you are able to use the Aerogen with this piece. You are going to have to use an adapter. Oops. And then you can use your Aerogen with this, okay? And if your policy does state that you do need to use a DEP with this, you can, whether it's going to be a DEP or the chimney style DEP, you are able to use it. You are just going to have to set your settings a little bit differently on the back end of your ventilator. So you are allowed to if that is your policies.